नमस्कार. आयच्या गजालींनी आयच्यो ज्यो गजाली आसात त्यो भलायकी विशयी आसात आनी आमचे बरोबर एक तज्ञ डॉक्टर आसात जे मुद्दाम बेंगलोरच्यान आज आमच्या स्टुडियोन आयिल्ले आसात प्रुडंट मिडियाच्या आनी तांचें नांव जावन आसात डॉक्टर कुमार स्वामी. ते कन्सल्टंट रेडिएशन ऑन्कॉलॉजिस्ट म्हणून HCG हेल्थ केअर ग्लोबल ह्या हॉस्पिटलान बेंगलोराक तज्ञ डॉक्टर म्हणून काम करतात. आनी आयचो जो विशय आसा तो एक थोडोसो गंभीर विशय की एक जाका आमी कोंकणी भाशेन कांक्र किंवा इंग्लिशीन कॅन्सर अशें म्हणटात. आनी ह्या दुयेंसा कडेन पळोवपाचो दृश्टिकोन जो लोकांचो आशिल्लो आज पर्यंतचो तो सदांच एक हें दुयेंस जालें काय प्रत्येक मनीस खंयचोय जावं तो कोणूय शिकिल्लो आसूं अशिक्षीत आसूं गांवांतलो आसूं शहरांतलो आसूं तरूण आसूं म्हातारो आसूं प्रत्येकाक एक गर्भगळीत अवस्था येताली आनी ताचो जिवना विशींचो जो दृश्टिकोन आसा तो एक नकारात्मक जातालो आनी ताका दिसतालें आतां सगळें सोंपलें, आतां कॅन्सर जाला म्हणजे एवरीथींग इज ओवर. पण आज परिस्थिती तशी ना. दिसान दीस हे आमचे विशय आसा ह्या नवीन विशयान नवीन उदरगत जात आसा, नवे नवे तंत्रगिन्यान उपलब्ध जावन आसा आनी ऑल दीस रिसंट एडवांसीस हॅज गिवन अ बेटर केअर अँड बेटर फॅसिलिटीज फॉर द पेशंट टू लिव अ व्हेरी हेल्थी अँड हॅप्पी लायफ. फक्त एक लोकांचो जो म्हणजे लोकांक ह्या विशयी एक जागृतकाय जावची, एक अवेरनेस येवचो ह्या दृश्टिकोनांतल्यान ही आयची कार्यावळ अशें म्हणूं येता. तर डॉक्टर कुमार स्वामी, आय वेलकम यू ऑन बिहाफ ऑफ प्रुडंट मिडिया. I welcome you to Goa. I welcome you to our viewers because definitely this is an opportunity they are going to get. And I want to discuss with you what are the advances in cancer management. But as we go towards the advances in cancer management, first in brief I would like to know how you define cancer or what you mean by cancer for in general layman's terminology.
Yeah. Actually, cancer is not like a typhoid or cholera which comes from outside the body. It gets generated inside. They are the rebel cells which so go out of control because of the various reasons. And to tell you frankly, it is not 1 day or 2 day or 1 week, 1 month it happens. These cells as they develop, there are some body, there are in our body there are cells called NK cells. They are like our policeman of the body. And they daily go through the entire body like an antivirus program, and if they detect any abnormal cell, they kill it. Achha. For in every normal person, about after the age of 40, these abnormal cells are happening in our body, and they are getting killed every day. Therefore, they don't manifest in the others. But in some persons, for some reason, they go a little out of control. See, if the number of policemen is less and thieves are more, it is very difficult to control. That situation arises, and then within the body some lumps develop, and those are the collections of these abnormal cells which has grown over the years. And the second most important thing about the cancer is it usually starts around the age of 30-40, but it manifests, it shows with the symptoms, with the problems after the age of 40-50. For it has some incubation period, what you call slowly one cell would have formed over years. About 10, 20, 30 years later, it expresses itself. In the meantime, if our body is strong, if you maintain certain good lifestyle habits, those are killed or suppressed and they don't manifest. Therefore, it is not only the inside cells, and when we don't take care of our body over the years, especially we might think that it is coming at the elderly age, 40 age, but actually it starts around 30-35 when our health is good, when we are capable. At that time we have to take care of our body to prevent it coming and manifesting at the later years.
Achha. Sir, as you have rightly said, since it comes at an early age, but gradually its manifestations start appearing at a later age. I would like to know what you mean by tumor markers, or what is the role of tumor markers in identifying or detecting this type of disorders at an early stage, so that people are little aware or they can take some preventive measures in managing their own lifestyle, I should say.
Actually, some of the cancers we can detect early. Like in a carcinoma of the cervix, what we call from the uterus, that arises from the uterus, that we have a test called Pap test. And now there are programs for women to get tested every year after the age of 40 by Pap test, by mammography and clinical examination, and we can detect some of the common cancers. And for example, in a country like Finland, they have eliminated the this cervical cancer by a program of detecting early and removing the tumor. For it, such programs are possible in the common cancer, and for the men also, say in the oral cavity or in the colon, when it develops, that can be detected early. And nowadays, the one cancer that is coming up, as we are living up to the age of 80, 90, 100, more number of people are living now. And we are facing now problem of prostate cancer, which can be detected by a test called PSA. For we can have early detection, and in which case our chances of getting rid of it, getting cured, is higher.
Achha. Doctor, I would like to know, like, what are the changes in management of cancer has come up in recent times than what we were traditionally followed? Because all these years people used to feel, okay, you have to operate, and then once the operation is, then a lot of means radiation, chemotherapy. I would like to know what are the newer advances and what is the role these newer advances have played in giving the quality life to the patient?
The cancer progress in the management I can put in two ways. One is our aim to cure it, more number of people to get cured, and we are trying to identify newer drugs, newer type of treatment, and trying to cure. The second effort has been to reduce the side effect of the treatment. As you know, many of the patients are not only worried about the cancer, they are worried about the side effects of the treatment itself, and they are so apprehensive about that. And one great change that has happened last 10-20 years, not only in terms of cure, which may not be as dramatic, but the dramatic decrease in the number of side effects that are possible. Be it surgery, surgery has become less and less now. The extent of surgery is so minimal. We preserve the organ now, retain the function, so that they will be totally normal. You go to the chemotherapy, the side effects of earlier there used to be, as the chemotherapy started, by the first cycle, second cycle, bone marrow depression would happen, cells will go down very badly, and some of the patients used to die because of that. But now we have wonderful drugs preventing that from happening. Just to reminded of chemotherapy, people would feel vomiting, nausea, and now it is not a problem at all. For the treatment has become very acceptable to the patient, and it has become more and more sort of with less and less of side effects.
So
this has
like
been the
patient friendly.
They have become patient friendly. Now take the example of radiation. Earlier we used to give radiation such a way that the normal tissues used to get as much radiation as the tumor. We are helpless. Now take this example, we can give an example in this cup, for example, which is on the table. If I want to give the radiation from two directions, it doesn't matter. Can I go for? It doesn't matter whether the cup is here or here, because I am directing the beam from here. But next to this cup, say consider there is a heart to that. And as we are giving the radiation, the heart would get the radiation. But now we give radiation such a way that we send from different directions beams. Therefore, we know precisely where the tumor is there in the body. This is called stereotactic. We are able, therefore, when I direct the beam from two directions, I should know the in that space where the tumor will be. And that is possible, and that development is called stereotactic radiation. And with that, we are able to produce now side effects that used to cause lots of problem. Say about 20 years back, if the patient had a cancer in the buccal mucosa, if he is cured, but rest of the life he would have dryness of mouth. Totally. Because of the, at the same time we give the treatment to the salivary gland. But now we can avoid the salivary gland and give a treatment called, by a method called IMRT. And it is possible that by 3rd month, 6 months, their salivation is normal. Their quality of life is good. For this has been one of the greatest achievements of modern day treatment.
This now what you are mentioning about that salivary gland, is it possible even for the tongue surgery, I mean the tongue cancers?
Well, wherever we were treating the head and neck, be it to buccal mucosa, be it to tongue, be it to throat cancer, the patient used to be forever with the dryness of mouth. But now we don't see that.
So you mean to say this is a more of a targeted therapy where it is more like a tailor-made, so that as per the individual needs, it is not like, okay, this machine is there and any head, face, neck CA is treated at this point of time. But the precision is so that every organ which is not affected can be saved
Yes.
from the radiation,
Yes.
so that the hazards of the radiation are are not occurring in this patient, so that they live a happy life and a healthy life also,
Yes.
because that organ is saved.
Yeah.
And other, apart from this, any other added advantage this your radiation has given? Your recent advances, I meant to say.
The moment earlier when we are giving the radiation, we are bothered about what will happen to the normal tissue around.
Yeah.
Therefore, we will give a dose such a way that we will not exceed the level in which the tolerance of your organ is there. Because we had a standard, heart would tolerate so much, lungs would tolerate so much, and we will not exceed that. Therefore, we are not directing the treatment to the tumor, to kill the tumor. We are directing the treatment such a way that no problem should happen, but if the tumor gets killed, it is all right. That was the situation. But now we are able to give such a dose what is required to control the tumor.
I see.
That is the, and because of that, we can expect more number of people going into the cure with this type of treatment.
Achha. And apart from this, what I wanted to know about the duration of the treatment, because earlier there used to be some sessions of some going for 2 months or 3 months, whatever is that number. So has this durations has been changed or with your newer therapy, so that patient can feel, okay, Baba, my treatment is getting over in 8 days or 10 days or 15 days. Is there anything new has come in?
Yeah, we have now, for example, a new technique of radiation has come. It is called as radiosurgery. It is something like similar to surgery. You finish the treatment with 1 sitting or at the most 5 sittings.
I see.
And sort of gives a radiation such a way that tumor is sort of cut off biologically. That's why it is called radiosurgery.
I see.
Although tumor doesn't disappear. In surgery, what happens? You
It is
remove the
taken out,
tumor.
correct.
But here the tumor is not removed. But in that period it is sort of cut off biologically. It will not grow further and slowly shrink over the period of time. This type of technique is called radiosurgery, and we have a new machine called CyberKnife. It's very expensive machine, but we have been able to bring to India, and with our sort of financial constraint, we are able to manage and offer this patient, at least some group of patients, this type of treatment we are able to offer. And this new type of treatment is called as radiosurgery, and the machine we call it as CyberKnife.